When you come to Summit, you'll see pictures on the walls. And they're pictures of people climbing, riding up, scaling, hiking different summits and mountains and scenery in the state of Utah. And I think there's a story behind these pictures that is relevant. And I want patients, and I want people that work at Summit and everybody really to recognize the significance of the pictures that are on the walls. In February of 2020, Summit was a relatively new practice. We had really just been operating for like 3 or 4 months. I had been in surgery in practice for 4 years. I had some experience, and as all surgeons, we're always learning and getting better, but the practice was brand new. And there was some snow, and there was a skier that was on a backcountry area doing some filming, and he crashed in the evening. And we had been operating that day, most of the day, and we knew that he was on the mountain. We knew that, or had heard that he had some kind of head injury, and it took 5 hours to get him off of the mountain in the helicopter. He arrived to the hospital at about 10:30 at night, and he did have a head injury. Really, he had a scalp injury. The ski had lacerated almost his entire scalp off, and it was just hanging. But what he really had is a spinal cord injury, and he had a fracture dislocation in his cervical spine and a fracture dislocation in his thoracic spine. So he had 3 major injuries that were relevant to neurosurgery. He was also hypothermic, and his friend had literally kept him alive on the mountain for these 5 hours where they were trying to get him off. We operated all night, and I even sent our spine rep, Scott Perry, up to the University of Utah to get some special instruments because we needed to do a transitional rod from cervical to thoracic. And we rarely have to do that, and it wasn't something we just had on the shelf. He ran up there at 11 o'clock at night, came back at midnight, just as we were getting going on the surgery. We wrapped up surgery at like 8 o'clock in the morning. We had done a fusion from C5 to, I think, T5. We had also done a fusion from the front at C5-6. We had reduced both of the fracture dislocations, and we had sewn up his scalp and had the ENT come in to sew up his ear. It was an injury he could have died from, and he survived, but was paralyzed from the thoracic fracture dislocation. His name is Louis. So a few days into his stay in the hospital, he had been suffering a fair amount of pain, and the realization that he would be paralyzed for the rest of his life was setting in. And we could help correct the alignment, but the spinal cord damage had been done. Louis was taken outside about 6 days after his accident to the courtyard of the hospital, and it was snowing. And so here was a man that had just had this unexpected accident doing something he loved, which was to be outside in the snow, who was now on the courtyard of the hospital in a wheelchair in all kinds of pain, knowing that he would never be able to enjoy that life again, that was gone. It was in the past. And I heard about this incident, and I rounded on him the next day. And so I asked him, Louis, tell me a little bit about your experience going outside into the snow. And I'll never forget his response. He said, I was just so grateful to be out there. And I just couldn't believe the attitude that he had. His road to recovery was long, it was arduous, but his focus on getting better and getting his life back was maintained. He kept just focusing on getting better and getting back to what he loved to do. Also, he had a team of providers around him that were supportive, that cared for him, and especially his loving wife and other family members that supported him through the process. This is the attitude that I hope all of us have. We're all patients at one point or another. Our lives become different because of the challenges that we face in one way or another. And the hope is that we can all focus on trying to get better the best we can and work together with family, loved ones, and caregivers in an environment where that is the focus. It's on getting better. And that, I think, is the clinical environment that achieves the best patient outcomes. Louis is the photographer for all of the pictures on our walls. He's the one that takes the pictures. People ask me if it's me in the pictures. It's not me in the pictures. I hike really nice, simple, easy trails with my feet on the ground. I don't do all of the crazy stuff that is in those pictures. But other people do, and that's their summit. That's what they want to achieve and accomplish. And Louis has captured those moments with film, and I love that. Everybody's objective and everybody's individual summit is different. And we hope to help patients along their journey the best we can. And it was a thrill to actually go skiing with Louis after his accident. He was in a chair, and his skiing is different than it was before. A little bit more challenging, but he loves it, and he can cycle and do photography and do all of the other things that he loves. His life is different, but he does have his life back. And it's Louis' attitude that I just wanted to capture and remember long-term within the culture of our practice. And one of the ways that we've done that is to put his pictures on the wall. And my favorite picture of all of them is a woman looking out over a landscape out of an orange tent. And you wouldn't know that this is Louis' wife, the person behind the scenes that really supported him through the whole thing. And family members are so important. But anyway, I just think that people should know that story. And people should recognize that that's the culture that we have and want to have in our practice, is a focus on helping the patients get their life back. It may not be the same in every instance. It may be a little bit different, but I think we can all have hope for getting back to doing the things we love and to having a good quality of life as we go forward.